Hello, this is Dr. David Green, CEO of the Mid-Atlantic Pain Network. Today's topic is what you need to know about facet joint syndrome. Well, what is facet joint syndrome? Every level of the spine has two facet joints, and you can see that they're about the size of a thumbnail, and they're on both sides of the spine, all the way from the neck down to the sacrum. They have cartilage, just like any other mobile joints, the hip or the knee. Individually, they're not very big. But together, there's so many of them that they allow us an incredible spinal range of motion. And even though they're small, they can be a tremendous source of pain. So the facet joint arthritis actually starts in the disc. The disc starts to degenerate here in the front, and it can shift abnormal stresses to the back of the spine where these joints are, and it can lead to abnormal motion and bony overgrowth, typical arthritis, cartilage degradation, inflammation of the area. Why is facet arthritis more complicated than a hip or a knee? First of all, there's no effective facet replacement like in the hip or the knee. We have not been able to figure out how to replace this joint effectively. Okay? There are two facet joints at every spinal level, and usually multiple are affected when you start talking about facet joint arthritis, facet joint syndrome. So if you go, there's two knees, there's two hips, but there's over 40 overall facet joints. And even though they're small, as I mentioned, they can produce a significant amount of pain, or none at all. Why do people develop facet syndrome? Most commonly, it's from simple degenerative wear and tear, osteoarthritis, also called degenerative joint disease. It can occur from a post-traumatic situation, such as whiplash. There's also a genetic component, a lot we don't understand. How's the problem diagnosed? Well, usually a person presents with a history and physical exam consistent with facet syndrome. X-rays can be highly suggestive, but a person can have really, really bad arthritis on an X-ray and not have any pain, or vice versa, okay? Interventional procedures can be diagnostic as well as being therapeutic. For example, here's a medial branch block. This is where the numbing goes around the facet joint, not into it. And basically what you're doing is numbing up these medial branches, which are the tiny nerve endings that supply sensation. That's why it's called a medial branch block. You're blocking that sensation. So that can not only provide pain relief on average for 3 months, but if it does, it then tells the pain doctor, aha, this is the source of the pain. Looking at treatment for medications, this includes, at first, anti-inflammatories and Tylenol. For short-term exacerbations, opiates can be very helpful. Prescription pain creams and patches can also be great. Physical therapy and chiropractic treatment have been shown to be beneficial, along with TENS units and spinal decompression therapy. Here you can see decompression therapy. It's computerized intermittent traction that can help a lot with pain relief. A medial branch block is a great treatment, as mentioned, along with diagnostic procedure as well. So these are the medial branches. Here's the actual facet joint. You have these medial branches coming down and these medial branches coming up. This is the nerve root itself. So when you do a medial branch block, you're not dealing at all with that. You're basically just working on these medial branches, okay? Intra-articular injections was when the needle goes into the joint itself, and you inject steroid just like you would into any other joint, and numbing medicine. And then a radiofrequency ablation is when a catheter is placed into this area. It gets heated up with thermal energy, and that actually deadens these medial branches. It doesn't do anything to the nerve root, but to the medial branches, it can deaden those for 12 to 18 months and provide excellent pain relief. So when you put medication into the joint, you see the needle going in here. That can provide pain relief for weeks to months as well. And then that's the radiofrequency. So what's a typical outcome of treatment? Well, the medial branch block has been shown to be 85% effective, with the average pain relief averaging 3 to 4 months. Radiofrequency ablation has been shown to be 80% excellent results with 6 to 18 months. And then it's been shown to be repeatable if the pain comes back. All in all, over 95% of patients are able to achieve a satisfactory non-operative outcome with facet syndrome, facet arthritis. The top non-operative pain management in the Mid-Atlantic region is through the Mid-Atlantic Pain Network. There are many clinics throughout the Maryland, Virginia, and surrounding areas. Over 50 insurances are accepted, with over 25 treatment options being provided by the board-certified, award-winning doctors. Visit us online today at midatlanticpainnetwork.com, and then call us for more information and scheduling at 855 888-444-6585. I'm Dr. David Green with the Mid-Atlantic Pain Network. Your pain stops here.